theme that you have today is ensuring safe workplace for business continuity in COVID-19, perspectives and way forward. So I'll briefly be touching upon this, and in the next 25 to 30 minutes, I'll try and address some of these issues. And I hope that some of your doubts or some issues could be addressed by my talk. So I'll start with my talk. And as we all know that COVID-19 has created a challenge for businesses to reopen. And this is something that is happening not only for businesses, even for schools, colleges, and a lot of other activities. Managers and employees feel a sense of urgency to get their business back to normal as soon as possible. But there's always this fear of a new wave or their place becoming a hotspot. And that has actually caused a lot of concern. New guidelines, revised practices have been developed, and they are looking at how people can really come back to a safe and stable environment when they return as far as occupations are concerned. So I will basically touch upon what COVID-19 is, how does it spread, and how it can spread at the workplace, and what measures we can take to prevent the spread of COVID-19, and what can be done to ensure a safe workplace. So COVID-19, we all know, is caused by a virus, which is a pathogen which exists in that gray area between living and non-living, because this viruses actually hack inside the host cell machinery and force the host cell, that is the human cell, as far as COVID-19 is concerned, to make copies of itself. And on itself, the virus cannot replicate. It needs to have a host for whose cell it hacks into to make copies. Corona belongs to a large family of viruses. It is an RNA virus, and it is basically there are four types of coronaviruses which cause minor symptoms like common cold. But the three which are more of concern to us are the SARS-CoV, which caused severe acute respiratory syndrome in 2002-2004, the MERS coronavirus, which is still there and started in 2012, and the SARS-CoV-2, which started in Wuhan in December of 2019. It's a single-stranded RNA vaccine, and is a single-stranded RNA vaccine called Corona because of its the fact that it looks like a crown, and it has these projections of the spike glycoproteins over the envelope, which make it look like a crown, and that's why the name Corona is there. Now, over the last 15-20 years, there has been a lot of concern because viruses have started jumping species and infecting man. We saw this with the H5N1, which was known as bird flu. We saw this with SARS. We saw this with H1N1, which was the swine flu. And MERS, and now COVID-19 is also a virus which has originated from either birds or various animals and then jumped species. So there is an importance for us to understand that because of deforestation, climate change, and the fact that the world has become smaller and there is a hyperconnectivity, infections are becoming more and more common, and they are jumping species. And this is something that we need to keep in mind because pandemics are here to stay. So COVID-19 is basically a viral respiratory illness, which is caused by SARS-CoV-2. Interestingly, this is a virus which can have varying severity. You have people who are asymptomatic. There are people who have mild disease, and there are those who have severe life-threatening disease, ARDS, sepsis, septic shock requiring ventilatory support. So it's a wide spectrum of disease that we tend to see. And symptoms are what we're all familiar with: cough, fever, chills, muscle pain, sore throat, loss of sense of taste or smell. And the test is basically predominantly an RT-PCR based test. It could be the traditional RT-PCR or using TrueNat or CBNat. And then there is also the rapid antigen test, which is useful in a situation where your positivity rate is high. As far as India is concerned, we had a first case report in January 2020 when 3 medical students who returned to Kerala from China were tested positive. We had a national lockdown on 25th of March 2020, saw the first peak in September 2020. Our vaccines got rolled out in January of 2021, and we've seen this huge second wave peak, out of which we are still coming out with 4 lakh cases a day in March to May 2021. And now there's this huge concern of a third wave, which may also come in the coming weeks or months. If you look at the burden of disease, India has currently has the second highest number of documented cases at around 3.06 crore. We have around 4 lakh people who have died. But the important thing to remember is, although this looks as a high number, if you were to look at the number of cases or number of deaths per million population, we are way down the list, and therefore we are not badly placed in terms of the number of cases or the number of deaths. It's only because of our size or the population of our country that this numbers looks huge in terms of the number of cases or the number of deaths. We are just coming out of the second wave, which we've seen as has been very severe, causing a large number of deaths and significant morbidity. And there is also now a decline as far as active cases are concerned. If you look at what happened in 1918, this was the Spanish flu. I think there are a lot of lessons from there, because there also the second wave was linked to lack of appropriate behavior, which led to a huge surge in the number of cases. And once this came down, again, because of lack of behavior, there was a third wave, which was not as big as the second wave, but it still happened. And this is something that we need to really see how history has taught us some lessons, and we still need to be very vigilant in terms of appropriate behavior. If you look at the mortality data due to influenza during that point in time, almost 7 to 10 million people died in India because of that. And the population of a country at that point in time was only 389 million. So significant number of people died during the 1918 pandemic, more than 100 years ago. And if you look at the pictures from that time, they look very familiar. This could be a COVID care center in today's time, a gymnasium or a hall being converted into a hospital. Again, you can see there is distancing and everyone is wearing a mask. Same thing that we've been doing today. Similarly, public gathering and places were ordered closed in many cities. Even all the police workers in the US had to wear masks, and there was actually a shortage of cascades because of mounting death roll. So the picture seems very familiar to what we were seeing today in various parts of the world. And there was an article that we written in 2018 that after 100 years, we are still vulnerable to a pandemic, and we should be better prepared because of the chances of pandemics happening. And there were a large number of warning signs that were there over the last 15 years. Now, how can COVID-19 spread as far as workplace is concerned? Because that is what we are concerned about today. Now, we all know that COVID-19 is transmitted as respiratory droplets being the predominant mode of transmission, that these droplets remain in the air for a short period of time and then fall on surfaces, which then can be a source of infection. There can also be some degree of aerosol transmission, that these droplets may stay in the air for a longer period of time and thereby be able to transmit or spread. And that also needs to be kept in mind, especially when we're looking at an indoor environment where there is poor ventilation. So therefore, in workplace, one needs to look at droplet infection and contaminated surfaces. And exposure can occur not only at the workplace, but while a person is traveling to work and during work-related travel to an area with local community transmission. So these are things that we need to keep in mind. And the risk of exposure or the risk of getting COVID-19 in a workplace depends on how close you've come in contact with a positive person, how frequent the physical contact has been with the person who is infected or may be infected, and how the type of contact that you had with contaminated surfaces and objects. Although now more and more data suggests that this may not be as important as we had felt in the past. So what measures can we take? I think the first important thing is that to protect ourselves and community, we must follow COVID appropriate behavior. And this should continue now more importantly than in the past, because now because the cases have come down, there is a little bit of laxity and we feel that we are in a better position. But masks, physical distancing and hand hygiene, at least masks and hand hygiene, should be aggressively followed. We should push for as much vaccination as possible, because this will also help in preventing people from severe disease and also break the chain of transmission. And limited lockdowns are required wherever there are hotspots developing, depending on the positivity rate or the hospital admissions. Again, if you look at lessons that we learned from the influenza pandemic in 1918, it suggested that those places which had tighter restrictions fared better. The mortality was less, and also they were able to get back to employment much more faster as compared to those cities which had a more lenient policy. And therefore, having strict policies and having tighter restriction helps in the long run, both in decreasing your mortality and also getting the employment back in place. These are important lessons that we need to keep in mind as we move forward. What about vaccines? Vaccines have been touted as the most effective public health measures to end the pandemic. As of now, more than 2.2 billion people worldwide have received the COVID-19 vaccine. This is remarkable considering that this disease is only about 18 months old. So in a new viral infection, which is only 18 months old, we have managed to not only make the vaccine, but inoculate 2.2 billion people. I think this is a great achievement as far as scientists and researchers are concerned, which would have seemed impossible if you had talked to someone maybe 2 years ago. This has led to widespread optimism that this is the beginning of the end as far as the pandemic is concerned. But there are still questions which remain, and these are vaccines truly safe and effective? I think now with 2.2 billion people having been vaccinated, we can say that they are definitely safe, although one may argue that we need long-term data to look for rare long-term side effects. They're also effective as data is able to show. Will they prevent disease transmission? That is there to some extent. How long will the benefit last? That is something that we need to look at. And will vaccine work against a new strain is also something that will have to be looked at. But when we talk of vaccines, especially for a lot of people, it's important to remember that vaccine induce an immune response among ourselves against the pathogen without exposing them to the disease. And for COVID-19, we have 60 vaccine candidates in human trial and over 180 in preclinical trial. So this is the first time that for one disease, so many vaccine candidates are being tried. But vaccines may actually work by preventing infection. Most vaccines are not that effective in preventing infection, and that means that you can still get COVID-19 infection, but it will be a mild infection or you will be asymptomatic, but you can still be infectious and give to the infection to the others. So if you're vaccinated, you may still get the infection, but the vaccine will prevent you from getting disease. It will prevent you from hospital admissions, prevent you from intensive care admissions, and it will prevent death. So we know this, that the vaccine will prevent severe disease. It may not be able to prevent infection, which is usually mild, and that is something that we need to keep in mind. It will also help in preventing the transmission of disease and thereby break the transmission and help in decreasing the number of cases. India has rolled out vaccines, and we have now Covishield and Covaxin. Both are available in our country, and from April onward, the Sputnik vaccine, the Sputnik V, has also been given the necessary approval. So we have now 3 vaccine candidates which are available in our country, and this is a huge boost and will help to ensure us coming back to the workplace and for business continuity. Also, the landscape is very encouraging. Besides this, we have now the Zydus COVID by the Zydus Cadila, the ZyCoV-D, which is a DNA vaccine and which also has applied for emergency use authorization. The Novavax is by Serum Institute of India, and hopefully that will also get approved. And then there are various other vaccines by Biological E, by Genovia, by Bharat Biotech. So we have a robust platform in our own country of producing a large number of vaccines, which will really be a game changer in the coming months and the subsequent year in terms of being able to protect our workers and be able to provide them the safety that they need for continuity of business. Also, Moderna and Pfizer are now exempted from the bridging studies that are required and have been given approval, and hopefully they will also be there in our country. So what about the vaccine that have been approved? And if you look at this safety of these vaccines, it varies. The efficacy of these vaccines, it varies from 66% to 95%. So there gives us a lot of confidence that these vaccines are really useful and will be effective. And that is something that has been done. That holds true for the Bharat Biotech vaccine also. This is the first phase 1 trial which was published early this year, which again was done, and our institute was also involved in this, which showed that this vaccine has good immunogenicity and its safety. And now with the phase 3 data, which has looked at more than 25,000 participants, the efficacy is around 78% and around 65% against the Delta variant, but 93% efficacy against severe COVID-19 disease requiring hospitalization. So therefore, it is a vaccine which is effective, and we need to push this so that our businesses can start. India's vaccine response has been very robust. We started gradually with our healthcare workers and frontline workers, but now it has really picked up, and we have now crossed 30 crore Indians who have received the first dose of the vaccine. And our aim is to be able to touch close to 1 crore vaccination per day. And I think this is something which is achievable. So what steps can businesses take to ensure a safe workplace? First of all, I think the goals of safe workplace during pandemic should be to make sure that the facility is fully clean, disinfected, and equipped with a blueprint to maintain safe condition. And this is something which has to be an ongoing process. There has to be a support system for employees who return to work and adjust to the new realities, because this is not going to be the same as it was in the pre-COVID era. And one will have to create a plan for safe work environment that protects employees, customers alike from the risk of transmitting COVID and reduce the chances of exposure and transmission. Classically, one looks at what is known as a Swiss cheese model to improve workplace safety during COVID-19. And this basically looks at multiple barriers which prevent, each preventive measure can take some protective measures against the holes which may be present with each, and this adds extra layer of protection. So you could have a cloth mask, you could have physical distancing, you could have cleaning and disinfectant, you could have hand washing and vaccination, and if all of these are combined, this will help in protecting the transmission of virus and protecting people from getting infected. So general recommendations, we are all familiar with that, but I like to repeat it. Wear a face mask, cover your nose and mouth when you're coughing and sneezing, and physical distancing as much as possible should be done. Get vaccinated, wash your hands regularly, and clean and disinfect surfaces which are frequently touched, like phones, keyboards, doorknobs, so that they don't become a source of transmitting the infection. Also, stay home when sick, avoid care facilities, and maintain healthy habits. It's important that you wear your face mask properly. Many people have a face mask, but they don't wear it properly in terms of the fact that it should fit comfortably against the side of your face. It should cover your mouth, nose, and chin, and it should be tight. It's important for us to keep that in mind, because if you don't wear your face mask properly and it doesn't form a good seal around your nose and mouth, then it loses its efficacy. And if everyone is wearing a face mask, then both an infected asymptomatic individual will not be able to transmit this infection to healthy people. And that is why everyone, the infected person and the healthy person, should wear a mask, because this really helps in decreasing the chance of infection. And that is why I think this should be really promoted very aggressively in all workplaces, that wearing a mask should be essential. Similarly, you must make sure that there is good cross ventilation, so that viruses which are airborne or which are aerosol can really move out from the environment, and therefore not allow the people there to get exposed and infected. Hand washing is again important, and you must do it regularly. When your hands look dirty, before eating, before and after coming in contact with an ill person, or if you've touched a surface where you're not comfortable with, hand washing is something that we must do regularly. As far as employees are concerned, I think it's also important to screen them, confirm regarding temperature, confirm regarding the respiratory symptoms, look for signs of illness, and as far as possible, try and maintain physical distancing as far as employees are concerned. You must look at cleaning and disinfection, and this is something that is important. Areas which have, it's not that has to be done for all areas. And it's very important that high touch surfaces like sinks, doorknobs, elevator buttons, etc. should be cleaned. But otherwise, it's not that every surfaces should be cleaned, because those may not require that type of disinfection that we were doing in the past. Social distancing and physical distancing, I've already said, one should try and maintain physical distancing as much as possible. And that means stay at least 6 feet apart. And also social gatherings or social functions should be avoided, because they can become super spreading events. What can be done at workplace? One is to set limits of how many people are in the building at one time. It means changing policies. It could be a flexible work site. It could be flexible work hours. You could have multiple shifts. It could also mean changing your infrastructure so that there is physical space between employees at the work site. And that would also help in terms of breaking or not allowing the infection to spread. And then you could use the current mechanism that we have of having meetings through phone or videos rather than having physical in-person meeting, and postpone non-essential travel. Workplace vaccination is also something that needs to be encouraged. This is now being allowed by the government of India, especially if you have at least 100 eligible and willing beneficiaries. This will prevent the need for travel and exposure to COVID-19. And it has been decided that family members of employees can also receive vaccination at the workplace. So workplace vaccination is something that one should look at and push as far as preventing the workforce from getting the infection. And this is easy to do. There are now a lot of designs available as how it can be done, from a waiting room to a verification desk to the vaccination area to the observation room and exit. This can be made in all workplaces so that vaccination can be done. And if it is available on the site, there is also a better incentive to get yourself vaccinated. It's also important for all employees to communicate to communicate with their employees, because it's important to maintain an incident command team or a COVID-19 task force in each area so that you have an action in place. You must be able to have some degree of strategy in place, whether it's looking at how you can align to your organization's values and mission, to rethink how you want to work, imagine how you want to communicate, and see how things can be done so that you don't allow your workplace to become a super spreading event or super spreading area. And you must watch out for symptoms, which could be, as I've already said, varying from fever, chills, cough, muscle ache, sore throat, to a loss of taste or smell. If any employee develops symptoms, he must be separated from the others, and he should be sent home to and instruct them to follow up with the healthcare provider. They should be closed off of all areas that the ill employee has used until they can be cleaned appropriately. And unvaccinated individuals with known exposure should be quarantined immediately and tested after 5 to 7 days. So an SOP has to be in place at all workplaces to ensure a safe work environment. Finally, it's very important to have employees' well-being and resilience. And like I mentioned, as we look at new occupations and new issues, this is something which is very, very important. And we know that stress is something which is very large as far as COVID-19 is concerned. Multiple factors are there: fear about one's health, is there fear about your family members, and therefore we have to really look at various mechanisms where we can develop strategies so that the stress is less and the workforce can become more resilient. So how can one improve employees' well-being and resilience and manage stress? One is encourage regular exercise. This can be done at the workplace, or something can be organized. You should ask people to maintain a healthy diet, because this stress can adversely affect eating habits and metabolism. At the same time, very important to connect with others. One must encourage this, because isolation can lead to depression and anxiety. And we've seen that very often during the lockdown, that there was a very large number of people coming with anxiety, depression, and therefore connecting with family members, friends, the colleagues in the workplace is very, very important. It's also important to take a break. That doesn't mean going out to a hill station for holidays, because that can itself become a super spreading event. But it's important just to have your own free time, so that you sort of switch off from news and other things which can sometimes cause anxiety, and find a balance of exposure. It could be reading a book, or reading a novel, or doing some physical activity, or really just doing meditation. But it's important that we take a break from day-to-day activities and are able to concentrate on our own well-being. Important to get enough sleep, because this is something that is very important. So have a good sleep hygiene and get good amount of sleep, and this will also help you as far as ensuring a good continuity as far as work is concerned. So I'll just like to conclude. I've just given you a broad overview that COVID-19 is a respiratory virus which can spread in the workplace, and this is something we need to keep in mind. The pandemic has seriously impacted both the workplace output and the workers' physical and mental health, and therefore we need to address these issues. We can't just look at the physical part, we have to really address the mental health issues also. And to restart work in the new normal, workplace will have to adapt themselves to create a safe working environment. I've just tried to touch on that, but each workplace is unique and they have to develop their own strategies. They have to innovate and develop a mechanism that they can create a safe environment for their workers. We need to look at multiple levels of layers of protection, which could be physical distancing, masking, hand washing, disinfection, and vaccination. And if we combine all of this, we should be able to get a good environment as far as protecting healthcare workers are concerned. And it's important also to have an SOP in place for screening all employees and exposed individuals, so that you have a plan and necessary action can be taken at the workplace if someone turns out to be positive, so that that area doesn't become a hotspot. And finally, workers' emotional health and well-being must be prioritized. I think that is also very, very important. So thank you very much.